Hello, and thank you for taking the time to sit down and go through this webinar. I hope you get a good insight into our university and also an introduction into our programme, which is a BSc Honours in Sport Injury Rehabilitation, and we're going to be chatting about concussion. My name's Dan Morris, and I am a graduate sport rehabilitator. If you are unsure as to what a sport rehabilitator is, we're going to be going through that shortly. However, just understand that we are a healthcare provider and we are regulated by the Professional Standards Authority. So just a little bit about myself first. I went to school locally at John Summers, which is unfortunately shut down. And I started off as a gardener in my professional career. And then I went back to college at Deeside College. And then I went on to study at Salford University, where I study sport rehabilitation. I went pretty much straight into working in football, where I worked for Fleetwood Town. And then I moved down south, so to the southeast, where I worked for multiple sports injury clinics down that way, where I worked in Berkshire, in Surrey, and also in London. And then I've come back and I am now teaching at Wrexham Glyndwr University. So aims of this session are a brief introduction into sport rehabilitation, an introduction to sports-related concussion, and understand the role of a sport rehabilitator within this context. So what is a sport rehabilitator first, or a graduate sport rehabilitator? So we help people suffering from pain, injury, or illness involving the musculoskeletal system. So we have a big emphasis on that musculoskeletal system when we are a sport rehabilitator, and we need to help people of all ages maintain their health and fitness, recover and prevent injury. So it's not just about recovery, it's about prevention too, and reduce pain by using exercise, movement, and manual-based therapeutic interventions. And there is a big emphasis on exercise and movement. So what is concussion, first of all? So if we look at a definition from the Consensus Conference on Concussion in Sport, they will call it a complex pathophysiological process affecting the brain induced by traumatic biomechanical forces. So effectively, we've got something that's complex, so there's a multitude of things that are happening, but there's trauma going on to the brain, okay, as a result of the mechanism of injury. And it's becoming fairly prevalent too. It's most probably always been very prevalent, especially in certain sports, except we're becoming better at monitoring it now, because we understand the importance of concussion. So if we look from the RFU's data, they're saying that there's one concussion per team every 10 games and one concussion per team every 25 games in adult male rugby. And in professional rugby, it is one every 2 to 3 games. Okay, so it's quite often, really. And there's a big importance to recognize concussion and remove people from the field of play. So, and this is because of something called second impact syndrome. So often what we had in the past is people returned to play too early and they got some of these people got serious consequences, and the potential was fatal. So we did have some fatalities of people returning to play to injury after concussion, and unfortunately it was fatal. And we started to recognise the importance of having testing to ensure that this does not happen. What mechanism would we expect? So it may be caused by either a direct blow to the head, face, neck, or elsewhere on the body with an impulsive force transmitted to the head. So one thing we see here is that we can have a direct blow to the head, face, or neck, but it doesn't have to just be that. It could be the fact that someone got tackled in the chest and that just caused a violent shake of the head, or it could be a road traffic accident or something along those lines where actually the head hasn't been directly hit, but there's still been some shake within the skull and the brain. And when we're looking at signs and symptoms of concussion, so a sign is something that you can see, and a symptom is something that the person will describe if they have concussion. So sport-related concussion can result in a range of clinical signs and symptoms that may or may not involve a loss of consciousness. So typically, we've always thought of concussion being related to a loss of consciousness. Now, what we know now is that someone can still have concussion and remain consciousness. Okay, so it's really important to have an understanding of other signs and symptoms. So as a task, pause the webinar and list and present, well, you don't have to present, but list some potential signs and symptoms. Okay, so what signs and symptoms do you think may be associated with concussion? Give yourself maybe 5 minutes to do this if you feel like you need it, and then we can move on. Okay, so you should be back now. Let's have a look at some signs and symptoms from our data. And what we see is, again, pause the screen. You can have a look at each individual one if you would like to. But what we see a range of signs and symptoms that range from almost emotional-based signs and symptoms through to changes in function, through to changes in just generally feeling sick, and also described feelings such as feeling in the fog, sensitivity to light and noise, so changes in sensation. So there's a multitude of different signs and symptoms that can occur as a result of concussion. So because we need to have, we know the importance of recognizing concussion, we need to ensure that we have an adequate exam that we can use, or a test to test whether someone has concussion or not. So what would you include in an examination based on those signs and symptoms? What tests could you make up? Again, pause the video, have a think. What could you do? So first things first is we need to consider our basic first aid principles. Okay. Now I'm not going to go in depth into this, but have a look at St. John's Ambulance website and also potentially go on one of their courses if you're not qualified in immediate first aid. But we need to be making sure that it's safe for us to go to assess the person, and then we need to look at our basic, are they responsive? Is there an airway? Are they breathing? Do they have adequate circulation? And then what has been developed is something called the SCAT-5 form, which is I guess a consensus-based form that's been created to make sure that we're all assessing concussion the same, and we're assessing it appropriately. And we're just going to go through examples from this form because we don't need to go through all of it. The link is there if you would like to, or Google SCAT-5 and it will be the first thing that comes up at the very top of the Google search. But we're just going to go through some examples and how it affects our brain and our cognition. So first of all, we can have a very quick screen of whether someone has potentially got concussion on the pitch. So you may be pitch side as a sport rehabilitator, and you may have noticed that someone has taken a hit directly to the head, or they fell over, or someone has just taken a violent contact, or potentially something has hit them on the head, you've monitored them for a short while and you're thinking they don't quite look right. Okay, so what we do at the safest point is we go onto the pitch and we ask them a series of questions to see, how's their current cognition? Are they a bit confused? Are they a bit dazed? So we can ask questions such as, what venue are we at today? What half is it? Who scored last in the match? What team did you play last week? Did you win? Okay, and these are quite simple questions. So I guess if someone doesn't know these questions, then we may be a little bit more concerned. Equally, do take into consideration that sometimes people will just generally forget. So you've got to know your players too. And then this is more of an example. So a finger to nose test is going to test our coordination. Okay, so you can have a little go at this yourself. So please sit comfortably on the chair with your eyes open and your arm either right or left outstretched, with your shoulder flexed to 90 degrees and elbows and fingers extended, pointing in front of you. When I give you a start signal, I would like you to perform 5 successive finger to nose repetitions using your index finger to touch the tip of your nose. and then return to the starting position as quickly and accurately as possible. So try that now. You can have your hand out in front of you, and you're going to, with your index finger, you're going to point to your nose as quickly as you can and return back to that start point 5 times. So in 3, 2, 1, go. Hopefully you didn't poke yourself in the eyes there. However, what you might find is maybe you were really good at it and you hit your nose every single time, or potentially even now that you're not concussed, you still had 3 out of 5 of them were errors, as an example. So this brings to the importance of making sure that we know what you're like when you don't have concussion, if we're testing you to see if you do have concussion. Another option is to look at months in reverse order. So now tell me the months of the year in reverse order. Start with the last month and go backwards. So you'll say December, November, go ahead. So obviously you're not going to tell that to me, but see if you can say it out loud. So go from December right the way through to January and see if you can get them in the right order. So again, you might have absolutely nailed that, or you may have found it quite hard. And again, we need to know this prior to using this as an assessment. And then that comes on to when to include these tests. And it shouldn't just be acutely. This is where, as we've just discussed, we need some baseline data. So a concussion screening tool is no different than all the other screening tools we use for knee injuries and ankle injuries and fitness tests. So at the start of the season, we get a load of fitness tests to see how fit a player is, and we get a load of baseline strength tests and baseline mobility tests to see does someone have adequate strength and mobility, and also if they do get injured, we know what their baseline is. Okay, and then we have a look. We should use this and retest this through the season, and we should use this post-season too. Are we using, when we're using this or we're retesting, have we retested before or after training? So physical activity will affect our cognition. So we need to make sure that if we're using this test, we're not using it at one point before the session and one point after the session. We should be using it, ideally, I would say, after training each time we use it. Okay. And then within a rehab setting, we want to be using this tool when we're progressing from the plinth, which is the bed, into the gym, onto our grass sessions, through non-contact to full contact, through controlled to uncontrolled, to limited fatigue challenge to maximum fatigue challenge, because skill-based training, increased physical exertion, increased fatigue, increased contact, all these things have the potential to almost challenge the trauma that we've recently had from the concussive event. So we need to make sure that we're retesting after we're challenging the body. Because what we might find is that someone's SCAT5 form is fine, they've returned back after 7 days. But when we start to challenge them under maximum fatigue, some of their concussive signs and symptoms return. And that would be really important for returning someone to the field and back to play. If you would like further information on concussion, it's a really good place to start is the head case aspect of the England Rugby website, which is information aimed to increase awareness and optimise the handling of concussion in rugby and sport. And it's individualised from healthcare providers to players and parents. So you could be a parent or a player or a coach or a healthcare provider, and they've set out online information courses that you can do for free to increase your own awareness around concussion. Obviously we are running the BSc Honours Sports Injury Rehabilitation Programme. If you have any questions on this programme, then please do ask on the day. We will have our lecturers on hand to ask any questions that you have and information on the course. And just some information on why would you choose this course. We're just looking at preparing students for the integrated sports and injury rehabilitation field. It's a little bit more focused on sports teams, fitness to work and health promotion. Okay. We're looking at developing skills in workload management and professionalism to optimize client care, be able to practice safely, competently, and confidently to ensure that you meet the exact standards of becoming a graduate sport rehabilitator, because we do have minimum standards that we must meet. We've got to be adaptable and responsive to the changing climate of sports rehabilitation, consider the wider holistic elements of health and well-being and how they affect recovery from injury, demonstrate and apply wider understanding and theoretical principles affecting sport rehabilitation. So if you have any questions, then please do ask them on the virtual open day, and we will answer them. And equally, you are more than welcome to email each lecturer individually too.